Social determinants of health can impact the quality of liver transplantation care. We sought to assess whether the association between neighborhood deprivation and transplant outcomes could be mitigated by receiving care at high-quality transplant centers. To do this, a population-based cohort study on patients who underwent liver transplantation between 2004 and 2019 was performed by identifying patients in a scientific registry of transplant recipients. LT recipient neighborhoods were identified at the county level and stratified into quintiles relative to the area deprivation index. Transplant center quality was based on the SRTR 5-tier ranking using standardized transplant rate ratios. Among over 41,000 recipients, the median age was 57 years and 2/3 were male. Patients residing in the most deprived areas were more likely to have NASH, be Black, and travel further distances to reach a transplant center. A multivariable analysis, post-liver transplant long-term outcomes were associated with care at a low versus high-quality transplant center, and those individuals residing in a high area deprivation neighborhood were at 25% higher odds of death compared to individuals residing in a low ADI area. Of note, individuals residing in a high versus low ADI neighborhood had a higher risk of long-term mortality when they were treated at a low-quality versus high-quality liver transplantation center. Overall, liver transplantation at high-quality centers may be able to mitigate the association between post-transplant survival and neighborhood deprivation, and therefore investment in initiatives that increase access to referrals to high-quality centers for patients residing in higher deprivation areas is important and may drive our ability to further mitigate disparities in liver transplantation.